Hello everyone, this is Vedangi Dev. So today my topic for paper presentation is stem cells in xerostomia. I'm a third year BDS student. Let's see what are the uses or the functions of saliva. So as you all know, it is antibacterial, antifungal, wound healing, buffer, a very important component in our mouth which helps us to regulate the entire metabolism in our body. Okay, so yeah, coming up to what is xerostomia. So, as our title says, stem cells in xerostomia. What exactly is xerostomia? So, xerostomia is actually dry mouth. It's a layman term which says dry mouth. So, dry mouth is actually associated with salivary gland hyperfunction. Now, what are salivary glands? Salivary glands are the one which produce uh, saliva. So their hyperfunction results into xerostomia or dry mouth. So reduced salivary flow can lead to lot of difficulties in mouth. This can lead to speaking deformities, then tooth decay, one of the most important reason, then also sensitivity, and also overall metabolism of body can systemically is also affected due to xerostomia. So it is likely to be a person is likely to be or systemically affected just because of being xerostomic, and it is not diagnosed properly. So this disease is not is like the disease can be a symptom of certain diseases. So it is not actually a disease, it is result of another disorder that is present in our body. So it is long lasting, it can be partial, like the complete mouth could be xerostomic, or certain areas of the mouth could be xerostomic. So yeah, why, what are the causes? Coming up to detailed causes of xerostomia. So xerostomia has developmental causes which are associated hereditarily. So these are salivary gland aplasia, then iatrogenic medications, then radiation therapy. Then there is loss of the problem of dry mouth could be directly associated to water or metabolites loss, which is reduced or impaired fluid intake. So then there could be other systemic diseases. So as arostomia is directly connected systemically, this systemic diseases make sense, like these uh, diseases like diabetes, HIV infection, and Sjogren's syndrome, which is one of the most important syndrome related to xerostomia. So, Sjogren's syndromes has basically person with Sjogren's syndromes. It's an autoimmune disease, and person with Sjogren's syndrome faces dry eyes and dry mouth. These are the continuous symptoms that he has. There are certain hereditary issues, and that leads to xerostomia as well. So there are also local factors such as decreased mastication, then smoking, mouth breathing. These are quite parafunctional habits that we have, also including the tissue abuse habits. Yeah, so basic management of xerostomia is there are chewing gums, then there are sugar-free gums. These are then one should limit his caffeine intake, because caffeine leads to dry mouth, increased caffeine intake. Then further comes like there are oh, management techniques such as saliva substitutes. So there are other substitutes for saliva. Then one should avoid those parafunctional or tissue abuse habits. Then medicines such as antihistaminics and decongestants. There are a list of medicines which cause xerostomia. So these medicine, even antihypertensives, can cause xerostomia. So these medicines should be basically they should be taken only when needed. You can't actually avoid these medicines, but you can just check with your physician to uh, replace, or just to maintain the xerostomic ratio. Then it comes, yeah, there's also one more most important management technique which we are gonna talk in detail, is stem cell therapy. Now, what is stem cell therapy? stem cells, basically stem cells are the cells that have the ability to renew or differentiate into specialized cells. So certain small cell could differentiate into a specialized cell, such as cell of an organ, or any type of cell which has functions, which has very important functions. So there are two major classifications. There are actually a lot of classification of stem cells, but talking about the basics, these are pluripotent as well as multipotent. So these can be obtained from a lot of cells in our body. One of it is like pulp as well in our teeth. So pulp tissue which is present has stem cells. So there are a lot of mm, body there are a lot of cells in body which can differentiate as stem cells. So yeah. So if xerostomia has a lot of other management techniques that are non-invasive, or they could be taken orally or just by limiting few habits, why do we need why do we need stem cells? So basically people with having Sjogren syndrome, as well as people undergoing radiation therapy, these people need a lot, these people have loss of saliva producing cells. So these cells, when these cells are lost, you cannot you don't, there's no use of giving substitutes or medications for saliva, because these cells are lost, they cannot produce saliva. So to produce these cells, to regenerate these cells, differentiate other cells from the stem cells into saliva producing cells, that is salivary gland cells, we need stem cell therapy. It is one of the most uh, sunrise, or one of the most researched topic nowadays, because there are a lot of people with radiation therapy, undergoing radiation therapy for different type of tumors, and they are facing loss of salivary gland cells, and even the Sjogren syndromes cases are also in rise. So let's see what type of stem cells are available for us to give this therapy. So basic stem cell, which is human amniotic epithelial cell, is derived from the topmost layer of amniotic membrane during C-section. It has to be taken during C-section, and one can just implant these cells into the body, and these are very useful. Then coming up to mesenchymal, this is the most important and most widely used stem cell. These type of cells are also used for other researches, whereas mesenchymal stem cells are also found very effective in xerostomia. So these are multipotent cells, as we saw the classification earlier. These are multipotent cells, they have very high potentiality, as I saw, and they are very easy to cultivate. So basically these are very easy to use. So this is one of the study that was done, wherein two type of mice were taken, and they were injected stem cells, and the results were seen. And as we can see, the results, just the stem cell salivary glands were salivary and lacrimal glands as well, they the cells were increased after 16 weeks. So these are kind, and this is the fluorescent microscope picture, wherein we can see a lot of increase in salivary gland cells from year to year. Then yeah, so what are the advantages and limitations? So advantages is, one of the major advantages, minimal risk of immune problems. Then we can easily isolate, then accumulate experimentally. And limitations comes to, there is risk of teratomas, there is risk of, there is limited number of cells. Then yeah, ethically it is always a problem. Yeah, so next stem cell is mesenchymal stem cell implantation. So this is one of the most implantation is basically taking up from one part of one person to another person. So implantation, mesenchymal stem cell, earlier we saw mesenchymal stem cell, this is one of the implantation. So mesenchymal stem cells were taken from the same body and giving out to same person, but implant we can use it from some other person, checking up the contact compatibility. So yeah, Next, these implants are given basically using intravenous injections, which contains mesenchymal stem cells. These mesenchymal stem cells are isolated and given. So yeah, it also preserves the saliva flow rate. There's twofold higher. So yeah, there's also reduced apoptosis. So earlier we saw the limitations um, were that these cells could create teratomas, or also they could have apoptosis. So similarly, in this stem cell type of therapy, we have reduced cell apoptosis, which actually gives us a uh, better rate of better rate of salivary gland cells production. So additionally, these type of cells also have an advantage of tissue repair and regeneration. So we had lost the cells of salivary gland production cells due to radiation therapy. So the tissue was also overall damaged. So these type of stem cells give an advantage of tissue repair and regeneration. Yeah, so next is adult human salivary gland stem cells. So yeah, this is also one of the most easiest to isolate. They are self renewable and differentiation. Actually, this is a property of stem cells, but these cells have um specialized characteristics because they are directly taken from salivary gland itself. So these stem cells have a better potentiality to differentiate. So these are isolated from parotid submandibular gland, or both in combination could be used, and they are quite similar to mesenchymal stem cells. So, these cells were, when compared twice, they were actually compared to the untreated ones. So the people who are not treated with any other xerostomia substitutes, so they were taken up for the research or the clinical trials. Then yeah, so these cells, so the type of salivary gland cells produced are acinar cells due to the stem cells. So the research done by Sarah Pringle et al. In 2013 restored salivary gland production with transplanted human salosphere derived cells, and greatly improved the regenerative potential of eradicated salivary gland. So, interestingly, interaction of transplanted cells with the salivary gland may also be involved in functional saliva, so functional recovery. So, basically, these cells were quite studied further by the scientists, and they found out that this could have also interaction with the transplanted cells of salivary gland and involved, and they could be very effective functionally. So yeah, next cells we come up with is adipose derived mesenchymal stem cells. So earlier we saw mesenchymal stem cells; these were just generalized cells used. Now we are targeting the specialized tissue, adipose tissue, for the stem cells therapy. So now these adipose tissue is a very common tissue available in human body. So most of them have fatty layer. So that's why they play a very convenient role. Then these are administrate these are pre precutaneously administered. So sorry. So yeah, and the salivary flow rate seen in this adipose tissue mesenchymal stem cells was one of the most highest, which was 75% increase in saliva. Then these displayed a group of more acinar cells and blood endothelial cells. So acinar cells were one of the most important saliva cells. So these cells directly gave us the acinar cells, which played a role of giving the idea of using adipose derived stem cells. So then they also appear to be a more potential option, as I told you, because adipose was readily available. And next we come up with advantages and limitation. Again, mesenchymal was one of the potential, adipose tissue was readily available. So now we have, well, mesenchymal had some limitations, and now adipose tissue also has some limitations. First we look into the advantages. So its phenotype is quite similar to that of bone marrow of mesenchymal stem cells. So as mesenchymal stem cells has advantage, this this is quite similar to mesenchymal stem cells, so adipose tissue seems to be quite potential. Then yeah, most important, as we discussed earlier, uh, adipose tissue is readily available, it is easily available, and this could augment to cardiac function similar to bone marrow in mesenchymal stem cells. Then limitations we see are they are somewhat invasive in isolation, although they are readily available, but they are a little bit invasive procedure, and they are limited expansion ability in vitro. Yeah. So, just salivary gland hypofunction could be repaired, or xerostomia could be repaired using stem cells, as well as some latest more technologies, which could be gene therapy, bioengineering, or low level laser therapy. And these therapies are quite studied, are quite considered for future treatments of xerostomia. So, concluding my presentation, I would like to say that stem cell therapy has to be a most potential therapy for xerostomia. It needs to be given a lot of attention, a lot of investment into. There's a lot of scope for researchers to come up with, and we have a lot of stem cells available, and they could give us a permanent cure for stem cells, uh, for generation of salivary gland cells. So yeah, thank you so much for your patient hearing, and these are my references. Thank you so much for the opportunity as well.